Mobile gaming has been one of the fastest growing areas of mobile applications. And within that area, there's an area called hyper casual, which is the fastest growing segment of mobile gaming. So our question that we ask ourselves is, can we use this power of mobile gaming to treat mental health conditions earlier and more effectively? Raj Amin. I'm CEO and co-founder here at Wise Therapeutics. We are focused on the engagement problem in mental health. This is a problem that you don't have to look far from the headlines to know that this is a massive issue today. We need to get to people earlier and more effectively with their mental health challenges. And today, engagement is a big problem. So getting people to engage early enough is one of the biggest issues facing mental health systems. Why aren't they engaging? There's a few reasons for that. Obviously, stigma is a big problem where people don't want to get therapy. They don't want to feel like they're weak. People don't have time to engage in a lot of the treatments that are available. And access and cost are also a huge issue where if you're trying to get to a therapist, you may have to wait months and months to get treatment. So we have to change the game in mental health if we're going to solve this problem. In another part of the tech industry, there's another area that's growing massively with engagement, which is mobile gaming. Mobile gaming has been one of the fastest growing areas of mobile applications. And within that area, there's an area called hyper casual, which is the fastest growing segment of mobile gaming. So our question that we ask ourselves is, can we use this power of mobile gaming to treat mental health conditions earlier and more effectively? And with Wise Therapeutics, we've built a company focused on this to really close the engagement gap in mental health by leveraging something that's already working for people today, by creating engaging, accessible, game-based treatments that are backed by science. And when we say science, we mean real RCTs, and they can be deployed complementary or additive to other treatment approaches. Now, our team brings together people who understand tech and consumer experience, like myself, as well as the real science behind our products, driven by my co-founder, Dr. Tracy Dennis-Tewari, who runs the emotion regulation lab at Hunter College and has done 20 years of research in the area and 10 specifically on some of the techniques that we use to deliver treatment. Now, one of the key factors that supports our company and really the growth of this category as software as medicine is the fact that prescription digital therapeutics have come on the market and have been supported by industry tailwinds, both in terms of reimbursement as well as the regulatory support for really approving these products as FDA-cleared services. And from our perspective, science is at the core of what we do. So we've actually run 7 clinical trials already on this technique via Tracy's research, focusing on our specific method of attention bias modification, where we showed significant impact in reducing stress and anxiety, and also in other areas, reducing factors like alcohol craving. So we know that there's a lot that we can do to leverage these techniques to give people engaging products that help them earlier and more effectively in mental health. Now, our strategy is really has been to go ahead with an over-the-counter product called Personal Zen, which is available today on the app stores. We're deploying that uses our core clinical MOA to deliver stress and anxiety treatment. That is what we have in the app store right now, but we are now launching a pipeline of prescription products which have an adaptive engine that will change the way that the app behaves based on how the patient plays it. And that is going through a full FDA approval process right now. So we've got a pipeline of products coming in the prescription space across a variety of different conditions that we are moving forward on getting approvals on right now. We're supported by a platform because it's not just about the product, it's how do you actually deploy it and integrate it into clinical workflows. So we have created a product called Wise Connect that we're now deploying with clinical partners and scaling up those deployments as we speak. So we are raising a Series Seed. We're starting our process now to move ahead with this Series Seed, which will support our FDA clearance process and our scaled deployments that we're moving into right now with our game-based products.
Awesome. Well, I love prescription digital therapeutics and just the rise of that category. But can you just explain to us a little bit more around that as a pathway versus an app like yours that could just go direct to consumer?
Yeah, sure. I mean, I think the key thing about prescription digital therapeutics is there's a lot of, say, apps out there on the App Store that don't have clinical evidence, right? And if we're really going to integrate products into how care is delivered, we've got to use the same kind of methodology that's used for other types of products in the medical industry. So having the rigor of getting an FDA approval for your prescription product means that you've run clinical trials the right way, your evidence is reviewable, and doctors can trust that your claims are correct. So that we think that's a really critical element of making sure that these products become a core part of how care is delivered today.
That's great. Definitely seems like key to the future, in my opinion. Question from an attendee: is the idea to have this B2B selling to providers, or maybe just expand on your business model now and in the future?
Yeah. So absolutely. In fact, I would say the over-the-counter product that we have available today is sort of a learning process. It's a way for us to learn and test features, but ultimately we will likely only have products available on a prescription basis in the future, because we really think it's so important, and we've seen this from our data, that when a provider delivers the product, we get upwards of 85% compliance for the recommended dosage, which is very short as it is. It's only 6 to 10 minutes, 4 days a week, delivers a clinical dose over a 30-day time frame. But having that clinician involved and having them prescribe it is a critical component of the process.
That makes a lot of sense. Question from Steve Krein. Great job, Raj. How much have you raised to date?
So we raised about $2 million to date. So that was in a pre-seed round. And obviously Steve knows I've done this a few times, so I'm pretty efficient with my capital. So it may seem like not a lot of money to have raised to get as far as we have, but we're just being pretty efficient about how we're spending capital.
A lot of people are trying to spend less time on their phones, less time on screens. How do you address those concerns while you're also trying to open up access to mental health services in a convenient way?
Yeah, no, it's a great question. And we are big believers of, and if Dr. Tracy was on, she would say that getting people off their phones is really important to mental wellness. So we only recommend that you use the product for a very short period of time. And so it's, but it is a device that's incredibly accessible. So it is something in teens' hands. It's in adults' hands all the time. So being able to deliver a very short, effective therapeutic effect that can happen in 6 to 10 minutes and then put the phone down, is sort of the direction that we're going. So if we could get you off of social media and have you focus on doing this small game for a short period of time, resetting yourself, and then moving into your day, that's the goal that we have with this, is reducing barriers and using tactics that people are already using to deliver treatment.
Awesome. If you can get it to look like Minecraft, I can get my son to use it instead of actual Minecraft.
Yeah, well, maybe they'll get some Robux points. You get some Robux for it too, for playing.
Oh, we haven't gotten there yet. Well, thank you, Raj. Great job.